Hey guys, I just wanted to give you an update of how everything is going and where I'm at and things like that. Basically today is November the 14th. Last time we left off, I left the questions, I gave you the surgery date and things like that. I had my endoscopy. My endoscopy went great, even the fact that I was super scared before going in. Um, the note to self, to all of you guys and all that stuff. Do not look up anything online about endoscopies. You're just gonna get scared shitless. I saw a video about a girl and she went in. The video is called Endoscopy from Hell. You could watch that if you want to or not. And she had the same. She didn't have the same doctor as me, but the same doctor's name, Dr. Patel. And so she scared the shit out of me. Let me just say that I even researched the place. I looked at who works there, and they have, doctors usually have pictures of themselves who works at a facility and stuff like that. So I looked to see if my doctor was there. Thank God he wasn't. Um, but anyways, she just made it seem like it was really bad. And a lot of other people make it seem like they're half awake and half asleep, and the doctor's talking to them, like, so the patient can help the doctor, like, put the tube in your throat and, you know, help you for you to help swallow so it could go in. But it's nothing like that. You're actually sleeping the whole entire time. You get put under. There's an anesthesiologist next to you the entire time. The doctor's there as well. They set you up, and literally within 15 minutes, you have a nap. Like you have the best nap in the world, and you come out. You don't even feel anything. They take biopsies of your stomach walls and you don't even feel it that they did that to you. Some people say you might have a sore throat. I didn't have a sore throat or anything like that. Um, so it was really good. Everything went well. Um, from the endoscopy, they found that I do have the bacteria, the H. pylori. Um, they gave me antibiotics for that, and because of the bacteria, apparently it's caused my stomach to swell. So they gave me medicine for that as well, which I hate that. Like I had to take my antibiotics was to take two every day and two times. Well, I had to take two pills 2 times a day, so in the morning and evening. Um, on top of that, I had another pill. I don't know exactly what that was for. I don't know if that was also an antibiotic or if that would help the antibiotics work together. So so in total, I had to take 3 pills a day, 3 pills a night. In total, 6 pills in one day. At this point, I was also supposed to take omeprazole, which is the to for the stomach inflammation, for it to go down, the swelling. Um, but my doctor made a mistake on the prescription, so I wasn't unable to get that until I believe 2 weeks ago or a week ago. And by that time, I already finished my antibiotics. And at this point, I had to take those pills until my surgery day, I believe. He said I'll be taking that for a couple of months, and I just can't anymore. I I got these pills out like 2 weeks ago, and I swear to God, I only taken like 5 of them. It's just horrible. I can't take. I'll show you. I cannot take pills that are like this in these capsules and like plastic capsules. I can't. They when I drink water, they get stuck on your roof of your mouth, your tongue. Like if your mouth isn't moist enough, and on top of the same thing, they do the same thing to your throat. So they'll get stuck there, and then they'll get soft and dissolve in there, and they smell. And I hate them. I told the doctor. I even told the pharmacies if they have another kind of type of the same thing in a different pill shape or form, so I could take them because I just can't. I'm this close to making a lie and saying that I'm allergic to the plastic thing just because it's that bad for me to take. Um, as far as that go, that went well. Last time I left off, I said I met with cardiology. They did a EKG. They also did an echo on my heart, which is a sonogram. And after that, a week later, I went in for a stress test. The stress test was great. I did really well. What else? Apart from that, my camera's being stupid. What's going on? Um, so tomorrow I meet with the surgeon for the third time, and that's the end of my basically the program thing. You know, the insurance either allows you to do 3 months or 6 months program that you have to weigh in and all that stuff. So that's the end of that. I won't be meeting him again until probably the end of January, close to being February, close to the surgery date. I say this because we left off before our last video that I would be having surgery on December the 1st, but it's been changed to February 5th for the fact that my insurance is being stupid and gay. And excuse me, all you gay people, for using the term, not using it properly, but basically my insurance I think covers just about 17 grand and maybe some change, and the surgery is known to cost about 20 grand and around there, 20 to 30 grand. And my surgeon, um, his team, his faculty members and all that stuff is which is bariatric associates, they negotiate with the insurance. They also, what they do is they don't like to bill their patients after the surgery is done. So they prefer to have everything done before the surgery and not to deal with any billing or anything. They just don't bill you after surgery at all. So what I was told is that I'm gonna have to pay $2,000 before surgery. There was no way, no how. It being November, last time I saw them. I'm sorry, it being the end of October last time I saw them. Close, literally being November within a week when I saw them. Telling me that I would have to come up with 2 grand. There was no way, no how that I was gonna be able to do that within a month. My salary, I'm only 21. I work as a cashier. My salary only allows me to make at least maybe $1,000 a month. So $1,000 in change. So by 2 months I would be able to get that. So we made a plan that on December the 5th, no, December, the first week of December, I would be able to come up with $1,000, pay them, and then the next $1,000 would be in January, the first week. Apart from that, I was expecting to have it done in the middle of January, and that's also not gonna be able to happen because they're booked. So February the 5th is gonna have to do. I meet with the surgeon, like I said, for the third time, which would be tomorrow, Saturday, the 15th of November. And I already had questions before prior, and I read them to you. Now I have another list of questions. They're shorter than last time. I feel like I should be asking more, but I just go blank when it comes up to this. When it comes to this and making up questions on the spot. So this is so far what I've got. What are before I actually get into the list of questions, um, I want to mention that I have a neighbor slash friend who recently had weight loss surgery, and she got the sleeve, and we were talking, getting some guidance, letting her, and she's been along the way, seeing how I'm doing and all that stuff. So we were talking about how she did the sleeve and she didn't want to do the bypass because she was scared, because it's riskier. She said, God forbid something happened in the future where they might have to do surgery inside of her, and that's just an untouched organ, like that extra piece of stomach that they just leave so the juices could flow. Um, Unlike the sleeve they just take out the other piece of the stomach, the other half, or more than half, and they just take it to the lab, and they use it for studying, and you stay with that pouch, opposed to the bypass where your stomach still stays in there, and etc. So she was scared of that, and she said also that You would have to take a whole bunch of supplements because you don't take in the same nutrients on in certain foods as you once did, and opposed to having the sleeve. um, when you have the sleeve, you still take in nutrients more than you would if you had the bypass. So she had me thinking and going there. I'm like, you know what? She's actually kind of right. Why don't I get the sleeve and stuff? But apparently, the bypass is, more effective apparently in the long run as well compared to the sleeve from what I heard. I'm unsure, so I'm gonna talk to the surgeon about this tomorrow. I'm still leaning still towards the bypass more than the sleeve, but it just got me a little bit up in thinking, a little bit more. Is this really my best option? So we're gonna talk about that. So these are some of the questions I am gonna ask the surgeon tomorrow. What are the advantages of this procedure compared to the sleeve? What are the disadvantages of this procedure compared to the sleeve? Have he done more bypasses than sleeves or vice versa? Um, what are the tests? What testing will I be doing before surgery? Like when I'm getting close to surgery, what are the tests that I'm going to be doing? And after surgery, will I be doing any other tests to come back, for appointments and stuff like that? Um, him being able to see my medical history and what do I have now and etc. Um, is bypass the best option for me, or is there anything better? Um, Me myself, forget the band. I don't even include that as a weight loss surgery. That's literally a joke. I'm sorry to all you guys who have the band. I hope you don't take this into offense, but it's just from seeing a previous video of some lady where she said that she has to go to the doctor and get these fills. I don't know exactly what these fills are, and I just think that's a waste of time. Like, why do you have to go to get these fills? Why do you have to keep doing this when you just could have done something else? You don't have to keep going back to the doctor and doing this. Me personally, if I have to get fills, I have to make co-payments to do that. That's just a waste of my time and my money. So it just doesn't make any sense. And the lady on the video saying that she has to go to the doctor to get these fills. The doctor where she goes, the same doctor doesn't do the fills. They hire somebody that's professional to do that, and that person currently or recently left their office and left the medical practice that they were doing there to go work somewhere else. So she wasn't able to get her fills for a really long time. I wouldn't want that to happen to me, so I just feel bad for her. I would not want that at all. So I just think that's just a joke. Like, why would you? Why would you do that? Um, so my other question is, what will I expect in my hospital stay? Like, what are they gonna give me? Not as food as medicine wise. I know a lot of people get gas pains is because they blow you up to, you know, be able to maneuver the laparoscopic tools in there. When I go home, will I be able? What will I be able to do? What will I be doing? Do I just stay home and rest all day in bed, or do I get up, do my normal things, or etc. Um, the doctor would see me how I am. He's seen me already three. He already seen me twice. He's gonna see me for the third time. He sees my body shape and everything. So I'm gonna ask him, does he think I will have excess skin? Will I have a lot of loose skin? I know he's gonna tell me that with exercise I should be able to tone up, but some people just don't bounce as fast or as good as they're supposed to. So that's that. I know they're gonna ask me about my sleep apnea thing. I don't know if I have sleep apnea. How can you tell you're sleeping? You know, I'm supposed to have a test done. So let me tell you about my period. Let me tell you about my previous. That sounds weird. Previous. There you go. My previous experience. So I see the surgeon last month. They tell me that I should see somebody for that. They refer me to a doctor. I go to this doctor's office. I was so mad when I left that doctor's office. So basically, I didn't know this is how it works. You go to the doctor's office. I have to make co-payments, like I said, once again, and my co-payments are $15 to see a doctor. So I go to see this doctor, and I'm sorry, my camera's gonna be stupid right now. Okay, so I go to this doctor, and he's asking me a whole bunch of questions to see if I qualify, I guess, to do the sleep apnea test, and that was it. I was just there for 30 minutes or less, just him asking me various questions, and for nothing, because he doesn't even do the test. He didn't even give me a device to take home to do the test. What he did was just ask me different questions to refer me to another clinic to send me there to do the test afterwards. So they send me home. They found the clinic where I can go, where they take my insurance. Turns out they called me a couple of days before actually going in for the test, and tell me that they're unable to because my insurance, one of the two, is in and out of network. I don't know which one. Insurance policies are so confusing to me, honestly. Um, so it's like, okay, whatever. That's fine. I guess I have to find my own doctor that would be able to do this on my own time. I'm gonna find a doctor that's near me to do this. So I call my insurance to find a doctor near me to do this test, this sleep study test. They told me someplace. First, it was some young lady. She was really nice and helpful to make me understand about deductibles, try to make me understand about the insurance policies and why they couldn't take me and etc. And she also told me I met my deductible fee, which is awesome because that means I don't have to pay $200 out of my pocket to um to do the surgery later on. So that's awesome. And she gave me some number, which is a Sleep Solutions, to basically get this appointment done and get the sleep study. So I call Sleep Solutions. I look up their location to see if how far it is. It's in Long Island. Apparently, when I looked up, the closest one near me is like an hour away, which I was like, oh my god, that's like going to Jersey all over again. Like, really? Um, when I called them, I was like, you know what, I'm willing to drive all the way over there to do this and get this done. When I call, they're telling me that I need even though a doctor referred me and gave me the okay in Jersey, and I paid $15 for their co-payment just to be okayed to get a study done, they told me that I still need to see their doctor to be authorized to do the test. So it's just like, I'm not gonna go in there and pay another $15 to be authorized when I was already authorized in the beginning. Like, it makes no sense. I'm not gonna be going over there, waste my time and pay and waste my money. So then I just left that alone. I didn't really make an appointment with her. That made me mad. Um, I ended up calling the insurance again later on in that week, and I spoke with a gentleman who showed me how to where I could find the nearest doctor around my area that does that. I found one very close to me. Um, I go and well, I didn't go. I call and make an appointment, and cool. Then I researched the address, and it looks like I know where the place is. I've been there before. It used to be a physical therapy place, and my brother used to go there when he had a car accident and had to get physical therapy. I used to go with him after school there. They changed it into a doctor's office, the bottom floor. Apparently, there's a building next to it, which you go upstairs and they do the sleep apnea. Um, so the day of my appointment, the day before, they call me to verify and confirm. The day of, I go with my parents. My parents want to make sure I'm okay and safe, that nothing's gonna happen to me. I go. I feel this place is a little too good to be true, and it definitely was. I go and I ring the doorbell. Some guy opens the door in sweatpants. He's like in sweatpants, a sweatshirt. He goes, I'm like, oh, it's here. You go up the stairs and stuff. And he goes, yes, you go up the stairs. I'm like, oh, it's on this floor. He's like, yes, it's on this floor. We go in. There's like a dining room table. On the kitchen area, where it's supposed to be a kitchen, that's where his TV is and his monitor or whatever. There's a bathroom. There's like a living room area, but that's where they have chairs for patients to wait. Then he said, "Oh, follow me. This will be your room." It was literally an apartment turned into a medical facility to do the sleep apnea test, which I found ridiculous, uncomfortable, awkward, and so damn stupid. In my head, I'm saying, what kind of cheap doctor is this? Like, you know how uncomfortable it is for a female to come in to want to need to spend the night to get a test done, having your employee in sweatpants, not even in uniform, having this place look unprofessional, looks like a motel. No, it looks worse than a motel. And I was just so like disgusted, disappointed. I was just like, and my parents was like, you're not staying here. Mm-mm. My dad checked the lock on the door to see if everything's okay. Like I'm only 21. Like I'm still living with my parents. Like, and so it was just a no no. It was so bad. Yeah, it was just like it's so unprofessional, and like maybe if there was another employee there, more patients there at the time. I was the only one there. He was the only employee. Maybe if they had a female and a male employee, I would feel better. But it was just very unprofessional. It looked ridiculous. And I was just so disappointed. And today I had to call different places, Google the place to see if it looked better, um, to make this appointment for the sleep apnea test because it's been ridiculous. Um, I had one place in Long Island as well. It's in a hospital. They're gonna hopefully call me back and see what happens because they have to contact the doctor that referred me in the first place to get this test done. Oh man. But so far with sleep apnea test, I've been going through hell trying to figure this out. And we'll see what happens there. I think this is as far as my iron infusions. Next week will be my last. I should have been done like the beginning of November, but I have not since I missed a couple of appointments. I go once a week, and I missed like 3 of them. So yeah, that's going on. And then after this month, which is November, I don't see the surgeon probably until the end of January or the beginning of February before the surgery. But other than that, I will have to go once a week to Jersey just to meet with the nutritionist to do weigh-ins just in case, whatever insurance. And I think that's all for now. And then I know when I get close to my surgery day, I'll have to do on EKG again and some other stuff. I don't know. We'll see. Just trying to take one step at a time. We'll see you then after maybe tomorrow or in a couple of months. Well, not a couple of months. Maybe after tomorrow or a month from now, I'll do another update and tell you how everything's going. Or maybe close to surgery date, tell you how I feel. Oh, by the way, I last video I shared with you what I be taking to the hospital. I'll share with you again. And I would like for you guys to tell me if I need to add anything to this list, you know? So my list is I would bring chapstick, magazines, an extra pillow, my phone charger, um, my laptop and my charger for my laptop, a toothbrush and toothpaste, uh, a book. Maybe I'll bring a book or not. My clothes to leave with that day. The clothes I'll probably wear when I go in is the clothes that I'll probably leave. I already have that planned out. It's gonna be sweatpants, a sweatshirt, my Uggs, boom, done, and my jacket, my coat, or whatever. Um, Socks because I don't like hospital socks. They always like tend to flip over on the wrong side. And my Adidas flip flops because I love them and I'm not stepping on hospital floors, hospital germs. Ew. I don't know if I need to add anything else to that. Oh, I bought a robe. This is my robe that I will be taking in. Um, if I'm missing anything that I should have for when I get back home, That would be great if you can share with that with me as well. Also, if you think I didn't ask better questions or good questions I should be asking, tell me. Let me know. I'm very open minded. I need all the information I can get. Right now, I'm kind of in blank. So please help me. Thank you. See you guys later.